This is part two in a three-part series. What we're going to do today is we really talked about why, the factors that influence our decision around integrating the CLAS standard into services. And today what we're going to do is really look at how the CLAS standards can impact education and school mental health in terms of literacy and school mental health. I am Suganya Sokalingam. I have been working with the CLAS standards since its inception as part of the Department of Health and Human Services work through the Office of Minority Health.
And I'm an adaptive change specialist with Change Matrix. I work alongside Suganya in this organization. And my background is in pre-K through 20 public education, both as a special education teacher and administrator in elementary schools, although I've also done some work in colleges directing various programs. We're just going to do an overview of this three-part series. So our last session, which again is available to you by recording, and we're on session 2 today. It's a deeper dive into the CLAS standards. Last week we went over just the first standard, and today we'll go over the remaining ones, with our next session being more around implementation and how to apply what you've learned. On our next slide is a quote from Kaylin O'Connor. She's a PhD out of Florida and runs a lot of health equity work. You can look her up if you'd like. She has many different articles, blogs, books, etc. But this question was around Black history, and she was asked what her hopes are for the future of Black mental health in particular, and wellness in the systems of care. It's such a great quote. She says, a world, my hope is, a world where health disparities are no more, and race does not predict poor health outcomes. A world where we have dismantled the system of racism, a world where people of color are not overrepresented in their experience of socioeconomic determinants that place people at risk for poor health outcomes. And on the next slide, we'd like to ask you a similar question. So what are your hopes for integrating the CLAS standards into your work? And if you would like to, we'd invite you to put that into the chat space, okay? What are your hopes for integrating the CLAS standards into your work? Our goals for this part are to identify the different standards within the 3 themes. And we're going to go over specifically theme number 2 and theme number 3, which contain many of the standards. And then we're going to determine the extent to which it might be modified for greater alignment and cultural sensitivity to your own context. I noticed in the check-in, we have a couple of community organizers. One participant is in charge of look like charter school, and then another person is a school mental health counselor, etc. And then when we come back again next week, we will again work on adaptation and how to apply this to your context. On the next slide is our learning objectives for this particular part 2. And that is to describe specific leadership, communication, language, engagement, and accountability standards. Discuss national CLAS standard implications in addressing educational institutions, and explore implementation strategies within the school environment. And we're going to show you that your goals are reachable. When you talk about implementing these on a community level, I hope that you'll see that it is doable. And then finally, this next slide is just recapping what we talked about in our first session. So what do we mean by when we say culture? First of all, we talked last week about culture is something everyone has and every organization has. And sometimes it's hidden and sometimes it's right there in front of you. So it's something else to think about our organizations as having their own culture too, and how accessible is that culture to others? What are we either purposely or or what's hidden as far as communication of the culture that exists within our organizations, and how can we lean into that and change that so that it's more adaptable and inclusive to all who come into our contact, right? And culture and language connected to health and education outcomes, absolutely. And this, especially in this day and age, when we're seeing schools that have 20 plus languages represented, and more cultures in within the school doors of a local neighborhood school, it's not even a question anymore. We have to connect these to our work. It's just an exclamation point there. The potential benefits of integrating the CLAS standards. So you can take a look at the social benefits, the health benefits, and the business benefits. I think one of the pieces that's maybe not included on here, but for me, that's very important, is that the CLAS standards also represent a relational based approach to our work, right? It talks about that a little bit in the social benefits around trust, inclusion, participation, but it's really creating a relationship by recognizing, validating, and creating belonging, which is by definition this idea of people being able to co-create their experience within a particular organization, right? That they don't have to just belong to something or be included into something, but that they can actually co-create by having this leveled area of access.
So the first set of standards, theme one, is really around people. It is around governance, it's around leadership, and it's around workforce development. And so one of the things that Yasmina shared last time is that she had this analogy of a cupcake, and she showed the frosting on the cupcake, and she said you will be able to see the frosting on the cupcake. And really theme two, which is all around communication assistance, is what we will see immediately and visibly in the CLAS standards. However, theme one and theme three, which we'll talk about later, are really the foundation. They're the cake base. You kind of make all of those things, the dry ingredients, so to speak. I would say this could be the dry ingredients that you need to mix with the wet ingredients, which it would be theme three, to bake the cupcake, and then you put the icing on top, which would be theme two. I love that analogy, and I'm hoping to borrow from Yasmina and share that. And in that foundational is addressing the needs of governance, leadership, and workforce development. Let's explore what that looks like. We are sharing with you both the health standard, the original standard, and then the adaptations that we have made at the Pacific Southwest Mental Health Technology Transfer Center. And really, the way to think about this is think about organizational, to be able to implement strategies, one, to recruit, to retain, and to promote at all levels of the organization. So it's not just diversifying your workforce, but it's diversifying your board, diversifying your C-suite, diversifying your administrative team, your leadership team, so that they're representative of the people that you serve. And so, and when you think about your school, that would be, your teachers, your administrators, your school board, all the different players that you have in the school system. The first one is the recruitment of diverse staff. This one is providing ongoing education and training. So if you're going to have the CLAS standards, it's not a one-time training on a one-time teaching. It is something that you need to do on an ongoing basis, that you provide to your teaching staff, to your school staff, to your board, so that that it stays fresh in everyone's mind. Looking at the governance and leadership, because if you don't have the governance and the leadership who are well versed in the CLAS standards, they're not going to be able to support the school system or an organizational of any kind to integrate the CLAS standards. So you've got to take the time to really educate and train them. And so that then they are able to change the policies that are needed. They are able to change the infrastructure that is needed. And they need to really, when they look at budgets, allocate resources accordingly. So these are the things that we really want them to be thinking about. So these are the three standards.
I just want to reiterate that we're really doing this kind of balcony view, this higher level view of all the standards, just touching on them very quickly, as you can tell. And then we'll make sure to send you some resources so that you can examine them to a deeper extent, along with some resources, electronic resources that you can take a look more deeply at the standards. Okay, so theme 2 is going to go over communication, language assistance, and health literacy. And we can go to the next slide. So some key terms, as many of you probably already know if you're working in the schools use these several terms to describe students, at least in varying levels of English proficiency. So they use NEP, LEP, and FEP, meaning non-English proficient, limited English proficient, or fluent English proficient. So this idea of limited English proficient means that they have a primary first language, and they're in the process of learning English, which research tells us takes a minimum of 7 years to get into even this upper level of limited English proficiency. To become fluent can take a lot longer. And so it's good to know that the majority of people that you'll run into are probably somewhere in this limited English proficiency level, but also to be well aware that people might be in more of an NEP or a non-fluent, non-English proficient. So standard 5 is around communication and language assistance. And thank you, Joanne, put the question in here. What are the top 5 languages spoken in your community or on your campus or in context of your work? And so in the education arena, this is to provide students and parents in their preferred language, this idea of language assistance. Okay, we sometimes also call that bridging, and written notices informing them of their right to receive language assistance at no cost to them. And you can see the health equivalent of that as well. Last session, we did talk about it's a right. It's not just an opportunity, right? It's not just a request or something that we can provide at our leisure, but it actually is a legal right of our parents and families to get communicated in their language that they can understand in their home language. Next slide, please. So this is a quick video talking about the power of what can happen within translation when we do it right. So this is our friend Snoop Dogg and sign language interpreter. So coming back to this idea of language assistance, as the video showed us, it doesn't have to be dry, it doesn't have to be boring, but it should be very professional. And it's also really good to inform yourself of what kind of language assistance is being provided by interpreters. So there are different levels of assistance, including in styles. So it includes like word-to-word translation, direct translation, or summative translation, where they summarize concepts instead of the word-to-word. So in this standard around communication and language assistance, educational institutions must, okay, I want to highlight that word, must assure the competence of language assistance provided to limited English proficient parents, families, consumers by interpreters and bilingual staff. Okay. Family and friends should not be used to provide interpretation services except on request by the parent. So a common practice in schools, as I mentioned, I spent most of my career in primary and elementary schools, was to have students do the interpretation. So this is not best practice, unless, again, if the family is requesting it, but we have to ensure that it's professional and that it's competent. There's examples, this little note by Ronnie. So says, Miss Clifton, Ronnie can bring his PSP to class all the time. He wants to. He has my permission. I am his mom, and what I say goes. Signed, Ronnie's mom. Another reason why we don't use students. In fact, I'll tell you a really quick story, but when I've used students before, I speak enough Spanish that I understand. I'm not at a professional level where I would feel comfortable translating even, but enough where I have a intermediate to high level of communication. So I've heard students translate, and they do exactly this. There's times where they feel like they can get away with saying something else to their parents when they're not really communicating the real message. So another reason, again, why we use professionals. Education, we want to offer and provide language assistance services, including bilingual staff and interpreter services at no cost to each student and parent with limited English proficiency. So I want to reiterate again that this is not just a nice thing to do, but it's actually required, and there's legal precedent for doing so. Okay, this includes any kind of action or communication as a school-wide system. Yes, thank you, Tiziana. Thank you so much. It's also like a lot of pressure to put on kids to have to know the information, right? And especially if it's about them, it's just doesn't make a lot of sense. But they have, again, this reiterates that it's no cost and it's in a timely manner during all hours of operation. So communication and language assistance, make available easily understood student parent related materials and post signage. So you can see the sign is simple, it's colorful, it has different icons, including the students doing the actions along with the verb or the action that they want to have happen. So this is an example of a great sign or signage in the language of the commonly encountered group. So also even better would be one with the same exact graphics, but translated into languages. So they're side by side or they're consistent. So this is an example. You can just see what are they trying to communicate here. Okay, this is an example of what we would call a best practice in both universal design for learning, which I can post a research for, but also in terms of this language assistance, right? Without using a lot of verbiage, it's still communicating quite a bit. In this case, that masks are either required or best practice, it's friendly, it's culturally relevant, et cetera, okay? So it's another place to lean into or think about is the signage around your place of work or places that you go into.
And this is theme 3. And in a way, when you think about theme 3, again, it is the things that are foundational and that allows an organization, a system, a school to sort of set this to be able to set up the class standards. One of them is how engaged is the school or the organization in the community. How engaged are they with other organizations that provide similar services or sort of additional services that can support the health and mental health of children. Then, of course, there is all the items related to continuous quality improvement, organizations and schools want to continuously improve. And so one of the things that they do is through measurement and accountability. So let's go on to the standards. Now, it's sort of a little bit of a hodgepodge, and there are about 8 different standards in here. And the very first one, standard 9, having appropriate a plan. And so like anything else, if you want to transform an organization, or if you want to change the organization in some meaningful way, you have to have a plan. And so one of the things that the standards advocate is developing a plan with clear goals, and being and added to those goals, making sure that they're both strategic and action oriented, and that there are accountability measures and oversight measures that are included in the in the plan. Because without that, you're not going to be able to see the changes that are being made. Okay. And in order for the changes to be made, there might also need to be some policy shifts that need to occur. And so you not only develop the plan, you develop the policies that need to go with it, along with the resources that need to go with it. Standard 10, which really looks at where is an organization. And so oftentimes it's important to be able to do a sort of a self-assessment of these activities, so that you can assess where the school is in terms of what they're already doing to integrate culturally and linguistically appropriate services. And then using that information as foundational information for developing the plan, and for prioritizing activities that might be needed. And so again, wanting to be sure to take a sort of a 360 approach to this. You want to you want staff to assess this, but you also want students and families to be able to provide information and feedback as to how the organization is doing when it comes to culturally and linguistically appropriate services. Because without family input and student input, you're only getting half the picture. And so that's an important aspect of the standard. Standard 11 is then looking at data. Oftentimes, we are not sure what exactly needs to get done because we don't have good demographic data. Without knowing who is in our school systems, in our communities, without knowing what languages they speak, what is spoken at home, those kinds of, without having that kind of data, it's very hard to create a plan that is meaningful for the students and the families, and to support a class. So getting accurate data becomes really important. And in order to do that, you really have to look at the forms, the existing data forms. Are they accurate? Are they, do they allow you to collect the kind of data that is needed? And so to also then, adapt the instruments, the intake forms, so that you're able to collect the data that is meaningful and that can be used. Standard 12 is really something we don't often think about, sometimes especially in schools and in health organizations itself. We become sort of isolated and sort of ethnic, sort of ethnocentric, in the sense that we are looking at our school system or our organization and saying, okay, what do we, how are we doing, so that we can determine how to best to provide services. But our children are not isolated in just our school systems or in our health systems. They're out there in the community. what else are they accessing, and what else is out there that can support us. And so being able to collect that sort of data will be very, very useful, especially because we know that in order for a child to excel and to be healthy, um, the social determinants or the social influences are really critical. What is the built environment like? What kinds of after school services are available to children? What's the food situation like? Are there grocery stores where healthful food can be purchased? Those kinds of things will impact school performance and the health of the child. And so collecting that sort of data becomes very, very helpful as well. Standard 13 is around ensuring that we are really looking at accountability, collecting the data, and using that data effectively. And so looking at the protocols that you have in place, the systems that you have in place, and how effectively are they able to help you gather the data that you need. Okay, standard 13 is around sort of having partnerships out there in the community and using a variety of ways, both formal and informal, to facilitate community and student involvement in designing and implementing class-related activities. This takes me back to my Project Aware days when we were working in Nevada. And I know in one school system, they used to have parents' nights and used to bring the parents in during one evening and be able to sort of share what the school is doing, the different things that they're doing in the school to support children. And that really made a difference in terms of the relationship the school then had in the community. And those are powerful ways. And so if you can imagine a very diverse community in which lots of different parents from very different cultures, if they can be brought together to connect with each other, the sense of isolation is reduced. There's so many benefits to that. And so being able to create these collaborative partnerships are critical. Sometimes we think that, oh, we're schools, this is not our work. But the thing that we find is that to be effective, in order to ensure that the school's child's mental health is served, there are these other things that we need to do that may seem like they're beyond the work of the school, but when you look at it deeply, it really is how we address the needs of children coming into our schools. Standard 14 is part of this is when you are serving a very diverse community and a very different mindset, people coming from different cultures will see things in very different ways. These are different perspectives, and there is a natural tendency for people to misunderstand, for there to be conflict, for people to be upset about how things are happening. And so it's really important within the system to have some kind of a process that will allow parents to come in, to be able to talk about it, and to address the needs of the families in the community. There are simple ombudsman's processes that can be offered, simple ways in which the school and school staff can take on this role of ensuring that this is addressed. And standard 15, you are making changes to ensure that your services are culturally and linguistically appropriate. Celebrate that and, talk about it, make it available, make it known to the public, make it known to the community. Communicating this information throughout the community will then help families become more engaged. They might be curious about it, may want to know more about it, and they may want to participate in it. And so communicating that is a very critical piece of it. And that is one of the things that will help to sustain it as well. And so these are the standards under this sort of network of activities that include engagement, continuous quality improvement, and accountability.
For next time is, how does governance, leadership, and staff take ownership in addressing the culturally and linguistically diverse needs of students and their families? So beyond you, what does the structure do to take ownership around this? How would you assess your school's communication as it relates to CLAS standards, and recognizing that not everyone's in a school? So your work context, how would you assess your context as it relates to the CLAS standards? And then, is engagement an important focus of your schools or your, again, your work context? So engagement as far as, to be more specific, across cultures and across different linguistic needs. We will lead this last session 3. We'll talk about implementation and sustainability. And there's a couple other offerings here. If you're not on the MHTTC website, that's the place where you can find. We thank you so much for being here